Your name is Dr. Afra Rafique.
That is correct.
So whereabouts? You're in British Columbia.
No, I'm actually in Winnipeg, which is Manitoba.
Okay. All right. Yeah, I've not been there. I have been to British Columbia. And how is Winnipeg?
It's interesting. I've lived in London most of my life and Oxford before we came. So I've lived in big cities. Winnipeg is a much smaller city, so it's a little bit different than what I'm used to.
And how long have you been there now?
A year and a half.
Okay, so you're settling in.
Mm-hmm.
All right. So let's just give me a background about who you are, your job title, and also where you were working in the UK, you said Oxford.
I I did my medicine in Dubai or UAE. In Ajman. And then I moved to England in 2011 for sort of neurosurgical training. That was sort of what I wanted to do initially. And then going through the hoops, I did lots of neurosurgical jobs, but I worked in London most of my neurosurgical training time. And then I met my husband and he said that we need to sort of have time for family and why don't you do some GP work? Whilst doing this sort of neurosurgical stuff in London, I was also doing some A&E shifts, and A&E shifts mainly focused on a lot of GP or urgent treatment center work. So that's when I realized I had this knack of, short appointments and I could do very well in the GP world because of the way I performed at the A&E UTCs. So then I retrained to become a GP and I trained in Colchester and Ipswich. Then I worked in Ipswich for a little while. Then I got a job in Oxford for a year and then we found out about Canada and then we decided to move here. From the decision till move was about 3 months.
Wow. What made you decide to want to move?
The thing is that you can imagine from 2011 to 2024, I constantly worked for the NHS. I love the NHS and I still do. And I worked and worked and worked, but I struggled with, I was the only breadwinner in my family. And we were struggling to sort of have a lifestyle which was concordant with what we did and, how we were raised. So somebody told us that actually Canada has more opportunity in terms of trying to earn more. So we then looked into it and it seemed like whatever work I did in England, I would get compensated for that in Canada better.
So it was a financial decision, but also sounds like a work-life balance decision.
In England, I was working 10 to 12-hour days.
5 days a week.
6.
6 days a week.
Mm-hmm.
And do you mind me asking if you have a family?
I don't have children. I have a husband.
But you were struggling to find the time to spend together.
Always, because I used to take Wednesday off. I was doing this to be able to, survive for both of us. And it was proving challenging.
So how does the clinical practice in Canada compare to the clinical practice that you were experiencing in the NHS?
So the clinical practice is more or less very similar. If we're just talking the clinical, which is medical, the same pathology here, same pathology in England, same sort of patients here, same in England. It's the same workload-wise, it's exactly the same.
So if you've been working and practicing as a medic, as a doctor in the UK, you can just step right into a role in Canada.
Yeah, it was literally, I landed here. 3 days later, went to work and I was seeing coughs and snotty noses as I would in England.
So in terms of patient expectations, appointment length, documentation, does that differ or is that the same?
So I'll start by saying that patient expectation is becoming challenging everywhere around the world. And because of the advent of AI, it has become even more challenging. Now, the patient expectation is obviously everywhere that we spend as much time with the patients as possible. But the thing is that that's not always a reasonable expectations or an expectation that is needed. I can auscultate and make a decision based on my findings within 7 or 10 minutes. Whereas some doctors would struggle to do that Or if it's a complex patient, we would give them more time. So it's very similar to what we did in England. In England as well, obviously we're allotted 10-minute slots per patient. I think the expectation in England perhaps is that because everybody does this 10-minute appointment thing and everybody's aware of it, I think the patients tolerate that slightly better. Whereas here, they sometimes want super long appointments, which are not paid. So it becomes then challenging for the doctor and the patient.
Yeah. Okay. What about prescribing, referrals, access to investigation?
The prescribing is something you need to just tweak and learn a little bit because obviously the same medications that are available in England are not available here.
Sure.
But obviously they have their own prescribing guidelines in terms of, for example, antibiotic coverages, depending on what the organisms and, sensitivities based on the area and place you practice. So obviously you have to change and tweak that. That's even in England. When I used to work in Ipswich, it was different. When I worked in Oxford, it was different. So
Okay.
it's different and something, dynamics. We need to update those. So prescribing changes. Investigations and access to investigations. I think it's very similar everywhere. We're sort of trying to catch up with investigations always. There's always long waiting lists, and that's become the way of the world, so to say.
Okay. And moving on to the sort of personal experience of the role, do you feel that you have more autonomy in your role here than you did in the UK?
Oh my God, that is the one thing that I love being here. I have total autonomy over what I do. So in England, I was a salaried GP, means that I had a rota. So my expectation was that when I become an independent practitioner, I would have more autonomy over my rota. I would be able to do whatever I want. That was not the case. If you had a clinic and you couldn't do that clinic for some reason, you had to find someone to cover that clinic and all that sort of thing. And I understand why. It's patient safety at the end of the day. However, it is a great tool to me as a person because I also suffer from a disability. So sometimes some days are harder for me to do, or if I have a little bit more, for example, tiredness or stress, or I had to do something, or I couldn't move my rota around, even though I was nearly 40 years old and working for the NHS for such a long time, and an independent practitioner, so to say. Now, in Canada, you design everything. If one day, for example, the snow is falling too much and I don't want to drive to work, I can change the appointments to a virtual one and I can work from home. I can, move days around. And patients are very understanding and they are happy to move things around. So you have full autonomy over what you do and how you design your day. That was one thing, is the rotas was just, brutal. You just had to do them. And the second thing was this, because I was a junior sort of GP, even though I worked in the NHS since 2011, I had a mentor. And the mentor-mentee relationship was challenging because everything I did was wrong. And it's frustrating because I wanted to be a partner very early on and sort of take a role of management, but they never thought I was ready. But the thing is, I do the same in Canada in a new country, in a new place.
It sounds like you feel that you're a little more respected.
Oh, blimey. You have no idea. Respect is something that I lost. I lost my identity in England as a doctor. Nobody respected, even the people you worked with. It's like, oh, you're a doctor, so big deal. No. Here, I went to the bank. There's a physician account with a special physician delegate that handles your bank account. When I went to buy a car, they did a special discount as a physician.
Wow.
It's like everywhere I go, it's a small city, so everybody gets to know you. Once I went to buy something in a store and I walked in. And first time I went to that store and they're like, hi, Dr. Rafique. And I got because I'm just like, is it on my face? And then it's like, oh, I'm your patient. So it's like everywhere you see your patients and they always are helpful and they respect you so much, like as a physician. If you say somewhere you're a physician, you get so much respect. And it's actually, something we lost in England.
That's really interesting. Okay. Yeah, that's a big takeaway.
Hmm.
You mentioned earlier about the pay. Let's have a little chat about that. So you can actually earn more doing what you do in Canada than you can in the UK.
So I'll say it this way. You still have to put the legwork. So if people think that they're going to come to Canada and they're going to just sit over here and get paid, it's not true. If you don't see a patient, you don't get paid. But if you see a patient, you get properly reimbursed and it comes to you as a doctor. So what happens is that the government pays the doctor directly for their services and you then pay a part to the clinic. This is opposite in England. In England, the practice gets paid and you get a salary, or when I was a salaried GP. So it's a little bit different here. Here, every doctor gets reimbursed for every single thing I do. And that's a huge positive for example, somebody like me. In England, I used to see 30, 40 patients a day. Here, I probably see in a 10, 12-hour day, 60 also.
60.
Mm-hmm.
Okay.
But
That's a
I would
busy
see
day.
this, yes, but I would see a similar amount in England as well,
Okay.
with include and phone calls and all that sort of thing. And if I am sorting out 60 patients, depending on what the concern is, because if the billing is divided into concerns as well and how long you spent on them. And, after that, obviously, I share a percentage with the clinic. And then I give a tax amount and then I keep the rest.
Okay. Good. So it sounds like living is good in Canada. Give me two things. When you first moved to Canada, what
Mhm.
surprised you about the place and what did you find hardest?
So the thing is that when we're in England, when we try to Google about Canada, or nothing comes up. Like, I was trying to look at physician incomes and all that sort of thing because I was like, obviously they had told me that this is what you may or may not earn, but I didn't believe it. And I said, okay, let me just do my own research. But the research didn't happen because the same websites don't come up in England because of the VPNs or whatever. So yes, so it was very difficult to sort of research about Canada. So I took a lot of, it was a leap of, blind faith really, and just like, okay, I'm going to just do this. But then the things that surprised me is how easy it is to set up life in Canada as a physician. So like I said, there's a lot of opportunity in terms of people giving you a car or a lease easily, and not having children perhaps makes that easier. But it was the ease of which how everybody respects you, even at the airport, getting the visa, getting here. It was just all quick, quick, quick.
You were made to feel welcome by the sounds of it.
Oh, absolutely. They still are very welcome. They still thank me for coming. And it's humbling.
Yeah.
And then the other thing that surprised me was how much people need you. So there are patients who haven't seen doctors for 10 years and they have multiple medications. They have been relying on virtual doctors for walk-in centers. And it's sort of like you actually changing something and you're making somebody better and you're making a change in their life. How many people I picked up with, cancer in the last stages because they haven't seen their doctor in so many years, or, providing services that patients are not used to, like home visits. Patients get shocked when I say, I'll come to your house, and they'll be like, we're not used to this. So
Yeah.
there's no sort of entitled, we need you to come. It's like, no, oh, thank you, you're coming.
Yeah. Good. I'm really pleased to hear that.
Yes.
I want to lastly talk about the help that you got from Canada Medical Careers, specialist recruitment agency, helping
Yes.
people like you move from overseas to Canada.
Hmm.
How big a support and help were they in your move?
Gosh, I couldn't have done it without them.
Oh, really? It's like that.
The amount of paperwork needed. I mean, I didn't do an exam. I just converted my training here. So they had to approve every single thing, which they rightly have to. And navigating through all of that, that's one part so that you can get recognized as a doctor in Canada, and the training sort of translates. The other thing was the visa business. It was so complicated in terms of, the medicals and the how to get, and I was forever scared because you kind of get the visa on the border. So you never get a pre-sent visa. So you land in Canada on your British passport and you say to them, I'm a doctor. Can I have a visa, please? And that scared me because I was like, oh gosh, that's too much uncertainty. But my gosh, within 15 minutes, the Canada Medical Careers obviously referred us to a solicitor who helped us prepare a package and, helped us. Then we went there and the package was ready to submit to the border agency or whatever they're called. And then he gave us a visa in 15, 20 minutes. And then when I came here, they supported me in how to, because you don't get your full registration until you have your visa. So that was a slightly complicated in a step. So then we managed to get here. We got the visa, we sent the visa stuff, and then they gave me my full registration to practice.
And all of those steps then, CMC, Canada Medical Careers, are hand-holding you through each of those steps?
Oh boy, I think they did an extra hand-holding for me because I hate, these little things. And because of my disability, I struggle with forms and how to do things properly. And what they did is they would sit down and spend even, hour, 2 hours doing forms with me and applications. And every single day, they'd be like, Dr. Rafique, click here, or Dr. Rafique, do.
Okay. I didn't realize they invested that much time, actually.
Yes, I would call them and say to them that I can't do this. They'd be like, nope, Dr. Rafique, just calm down. They'd keep me updated on every step because, sometimes things take time and they'd say, don't worry, it'll come. They have quite a big team. They all were wonderful with me. So I wouldn't have done it without them, really. I feel like navigating the system. And when I spoke to John, I found out about Canada Medical Careers because I Googled Canada things online, and he was the only Canadian number. So I said, he must know something. So I sent him a text from work, and he said all about, oh, how do I move to Canada? That's all I sent him. And he said, can we have a chat in an hour? So I finished work and it was sort of morning time. And I remember having a phone call with him. And he's like, can I just ask how old you are for like the visa purposes and stuff? And I said, I'm so and my husband. And he's like, yeah, this is what we do. He then said, would you like to give an exam? I didn't know nothing about cancer. I didn't know the cities, where to practice, where to start. And John is like, would you like to give an exam? And what would you like to do? And what's your home situation? And then he recommended Winnipeg to me. And then he said, would you like to go for an interview with the owner? He spoke to the owner of the clinic. I said to him, yes, I'll do an interview like a week later on my day off. And he's like, no, we need to do it in 2 days. And then I had a phone interview and gosh, rest is history. That was, the contracts were sent and it was all signed and we came to Canada 3 months later. We could have come earlier because because as a salaried GP, you have to give a 3-month notice. It took 3 months to do that notice.
It's still very fast, isn't it?
Oh yes, it was super quick. I don't even remember it now because it was so fast. It feels tedious when it's happening, but the Canada Medical Careers, John and his team really, helped me go through navigate every single step. So that's made it like, yeah.
Well, that's really good. Thanks very much for that. What would you say to your old self thinking about whether you should or shouldn't move to Canada?
Gosh, I think I should have done it earlier. Because I'm sort of in 40s now and, you know, then these whole complications of when you want the permanent residency here with your age and there's points. And so the younger you do it, I think is probably better. I'm not sure, but I feel like I should have done it much, much earlier. I feel like it's been good for my mental health. It's challenging sometimes, but when I hear about the troubles back home, I feel like, I made a good decision in a good time.
Good. Well, that's really pleasing to hear. Thanks very much, Afra. That was a really nice, incisive oversight into how to move to
Thank
Canada as a doctor. Thank you very
you.
much indeed.
Thank you.